Platelet-rich plasma is generated from your own blood. A sample, usually 5 to 10 teaspoons, is taken, spun down in some procedures once, in some procedures twice. And what happens from that process is you separate your red blood cells, which of course carry oxygen, your white blood cells, which fight infection, your platelets, which are involved in all kinds of inflammatory cascades and healing processes, and all the other plasma. What you're looking for in those platelets are what are called exosomes. Platelet-derived exosomes. What an exosome is a small soap bubble filled with proteins, mRNA, RNA that are very specific to healing and inflammation. And when these are released from the platelets, your blood clots form and your damaged tissue is repaired or cleared away and new tissue is stimulated to grow. So if the average person has 150,000 to 300,000 platelets per cubic millimeter of blood, the act of spinning that down, of making it platelet-rich, can sometimes increase that 5 or 6-fold. And you can get easily 750,000 to 1.5 million. So the idea is separate the platelets, spin them down, re-inject them back into the joint, into the damaged tissue. And now you've got a super concentrated, platelet-rich concoction that's going to be able to really get the most out of healing. What makes this a challenge is you're not always sure how many platelets make it through. Do you get 5 or 6 times, or do you get 1 time? Most research shows you really need to have about 750,000 to 900,000 in order to have an effect. Now, you've got to have concentrated that at least by 200 or 300%. Some of the newer procedures can get 500 or 600, but when it's under so much speed and so many times being spun, you got to worry that some of those are damaged. That's the concept behind platelet-rich plasma. You inject that back into the tissue, you inject that back into the damaged joint or the muscle, with the idea being that those exosomes, those specially designed soap bubbles in this platelet that induce healing and induce rejuvenation and regeneration, that you've got significantly more of those. That's how it works. Dr. Mack Medicine.